Hello everyone, this is Dr. Naz and I'm here with a brief video on transposition of great arteries. Transposition of the great arteries is a congenital heart defect where the position of the two major arteries leaving the heart, the pulmonary artery and the aorta, are switched or transposed. In a normal heart, the aorta rises from the left ventricle and carries oxygenated blood to the body, while the pulmonary artery rises from the right ventricle and carries deoxygenated blood to the lungs. However, in transposition of great arteries, a pulmonary artery arises from the left ventricle and carries oxygenated blood, while the aorta arises from the right ventricle and carries deoxygenated blood. Aorta lies anterior and to the right of the pulmonary artery. This therefore results in separation of systemic and pulmonary circulation, that is, the abnormal positioning of the great artery resulting in two separate circulatory loops that are not effectively connected. As a result, oxygenated blood from the lungs is recirculated back to the lung, and deoxygenated blood from the body is pumped back to the body. This leads to a lack of efficient oxygenation of the body's tissue and is incompatible with life. Therefore, the postnatal survival requires mixing of the blood by a ventricular septal defect, atrial septal defect, or patent ductus arteriosus. So this is a flow diagram, and you can see the deoxygenated blood from the body is redirected again to the body without being oxygenated, and the oxygenated blood from the lungs is redirected to the lungs again. So we have created three defects. The first one is foramen ovale or atrial septal defect, the second one is ventricular septal defect, and the third one is patent ductus arteriosus. Any of these defects will lead to the mixing of the blood, that is oxygenated and deoxygenated blood. So the body will at least get some of the oxygenated blood for proper functioning. So transposition of the great arteries is the most common cyanotic lesion presenting in the immediate newborn period within the first 24 hours, and it presents with tachypnea, tachycardia, diaphoresis, failure to gain weight, and the risk is increased in the infants of diabetic mothers. ECG will show right axis deviation due to right ventricular hypertrophy. As we all know that the right ventricle is not designed to pump blood against high systemic pressure, and it has to generate high pressure to deliver blood to the body. This increased workload on the right ventricle leads to hypertrophy, which is the thickening and enlargement of the muscle due to workload, and it is noticed after 3 days as upright T waves, especially in lead V1. Chest X-ray will show cardiomegaly and increased pulmonary vascularity. Egg-shaped silhouette and narrow mediastinum can also be seen. So for the treatment, we can correct any metabolic acidosis, and we can give prostaglandin E1 infusion to keep the ductus arteriosus patent, and oxygen for severe hypoxia, diuretic and inotropes if needed for cardiac failure. However, without surgical correction or surgical intervention, transposition of great arteries is usually life-threatening in the first few days or weeks after the birth. And the treatment involves surgical correction, typically in the form of an arterial switch operation. This procedure involves switching the position of the pulmonary artery and the aorta, restoring the normal circulation of the oxygenated and deoxygenated blood. The associated VSD, if present, is also repaired during the surgery, and the prognosis is poor without surgery. That's it. I hope you learned something from it. If you do, please like my video and subscribe to my YouTube channel. Thank you so much for watching.